Hello, my name is Dr. Bill Thatcher. I'm a chiropractor from Ann Arbor, Michigan. I want to thank you for taking your time to watch this brief introduction, and our purpose is just to introduce you to our practice and the things that make our practice unique. We have a beautiful office physically. We have a wonderfully highly trained and friendly staff, but more importantly, we utilize a specialized treatment technique called Activator Methods. Activator Methods has been around for over 50 years. Over 1/3 of all the chiropractors in the world now utilize this technique, so it's widely used. 35 years ago, when I got out of school, I had an invitation to go to Minnesota and work with the chiropractor who invented Activator Methods. And I worked with him for 2 years in his clinic. While I was there, I began traveling with him and teaching. And for the next 20 years, I traveled all across the country teaching postgraduate seminars to other chiropractors, teaching them how to use Activator Methods. So I've been doing it a long time. I know how to use it well. We get fantastic results with it. The advantages of the Activator is that we don't do any manual manipulation. There's no twisting or cracking of the spine. All the treatment is given with a small handheld instrument. The advantages of the instrument is that it's very safe. It's very gentle for the patient, but it's very precise in hitting just the right spot. You probably remember back in your high school physics class, there was an equation called Newton's second law. Newton's second law says force is equal to mass times acceleration. With the old style of manual manipulation, there was a lot of mass, but it was relatively slow. It was only as fast as the doctor could extend their arms or their hands to move the structure. Now with the Activator instrument, we've simply tipped the teeter-totter the other way. We've lowered the mass, but we greatly increased the acceleration, and we still produce force. We're actually using 50 pounds of thrust with the instrument, but it's delivered in 0.003 seconds, 3 milliseconds, in and out. And again, it's very safe, very gentle, very precise. Let me take a moment and tell you what to expect on your first visit. You should allow 30 minutes for your first visit, and after you get your paperwork done, you and I will sit down and we're going to discuss your history. I'm going to ask you a lot of questions, and I want to thoroughly understand your problem and what got you to that place. Then we're going to do an examination on you, and when we examine you, we look at you from two perspectives. We look at alignment. We want to see how everything is lined up, your hips, your legs, all your vertebrae. We also look at function. How well is it all working? Is it moving smoothly, or is it stuck or stiff? If we find a problem in either regard, we use the instrument to correct it. After you have your adjustment, before I send you home that day, I'm going to give you some instructions on what to do at home. We may give you some exercises that would be appropriate for your condition. And along the way, I really emphasize the importance of what I call lifestyle coaching, where I will try to share with you how to bend properly, how to lift, how to protect your back. The purpose is to try to prevent this from ever coming back again. And then lastly, I want to share with you that in addition to the chiropractic services that we provide, we now utilize something called low-level laser. The laser is a wonderful adjunct to the chiropractic work that we do. The laser does a couple things very effectively. Number one is it reduces inflammation dramatically in the tissue, and a lot of the pain that people have is from inflammation. And then secondly, it speeds healing in the tissue, up to 30% faster healing by applying the laser. So if your case warrants it, we will suggest also utilizing the laser. I really appreciate you taking your time again to listen to this, and I look forward to meeting you.